Hey, what's up, dude?
Hi.
I'm Douglas Hartwell, your student nurse for today. What's your name and date of birth?
My name is Jane Smith. I was born December 12, 1999.
Cool. So what are you here for today?
Well, I think I have insomnia recently. It's really
That
a problem.
sucks. I had insomnia when I was a kid. I hated it.
Yeah, well, I was just wondering if you had any, tips or anything that could help me get rid of it, because it's really hard to focus in my classes and doing my homework.
Dang, that's rough. I think... Oh, this is important. Hey, bro, you ready for the party tonight? Yeah, buddy. Alright, cool. Peace, bro. What was I saying?
You were telling me what could help with my insomnia.
Right. I think I'm going to suggest to the doctor to put you on triazolam, and you should be all set.
That's it? There isn't anything else I can do without taking medication?
You can, but honestly, the medication is just easier, and it'll save time, both for you and for me.
Can I talk to an actual doctor?
He's actually predisposed at the moment, and I actually have to move on to the next patient. Well, have a good one.
So as you can see, there were numerous mistakes made by the student nurse in this scenario. Straight from the beginning of the nurse-patient interaction, the nurse addresses the patient far too casually, didn't check the bracelet, forgot to wash hands, which could potentially spread pathogens from one patient to another. Throughout this scenario, the student nurse did not speak in a professional manner, was rude in dismissing to the patient and their concerns, which reduces the patient's trust and respect for the nurse. The nurse failed to give full attention to the patient as well, such as when the phone rang. The nurse neglected to suggest any non-pharmacological methods to help reduce the insomnia, which is avoided in the healthcare decision since the goal of treatment is to go from least restrictive to most restrictive treatments. From this interaction, the patient was left feeling confused, frustrated, uncared for, and maybe less apt to seek medical attention in the future. Now you're going to see this video again from the beginning, although this time you will see how the competent nurse would have acted in this scenario.
Come in.
Hello, how are you doing today?
Great, thank you.
So, I'm Douglas Hartwell, and I'm your student nurse for today. Could you please give me your name and date of birth?
Yeah, Jane Smith, December 12th, 1999.
Awesome. And if I could just see your bracelet quick.
Yeah.
Alright. How can I help you today?
So I think I have insomnia. I get really tired during the day. It's a lot harder to focus in school, and I was hoping you had some suggestions to help get rid of it or help with it.
Okay. Can you please elaborate on some of the other symptoms which you think could indicate the presence of insomnia?
So I find it really hard to fall asleep at night, and I wake up a lot throughout the night. I can't get a good night of sleep. I'm normally a great student and I stay focused, although recently I haven't been able to stay on track, and I've been more irritable than normal too.
Yeah, that sounds like insomnia all right. Do you know what you think could be causing it?
I'm not really sure. Typically I'll take 2-hour naps during the day after school, and when I can't fall asleep, I normally just keep trying to fall asleep, although sometimes it takes hours of just laying there.
Okay. There are several methods that we can use to reduce the sleep problem. There are certain drugs you can use for it as well, but let's try to see if we can go without them and use natural methods instead. One method which can often help with insomnia is trying to assist your brain to associate your bed with sleep. The next time you can't fall asleep for around 20 minutes or so, try getting out of bed and doing some other activity for around 20 minutes or so, and then try falling asleep again. Another method you should try is to not spend too much time in your bedroom during the day. Both of these should help a lot in improving your sleep quality.
Okay, I'll try it.
Awesome. So how about you come again in 2 weeks and we'll see if your sleep has improved. If it hasn't, then we'll assess for what the next step should be.
That works for me.
Awesome. Do you have any other questions for me today?
I don't think so. Thanks so much for your help.
Alright, for sure. Have a great day, Mrs. Blair.
Thank you.
In the scenario we saw, the student nurse performed his nursing duties with professionalism and excellence. This time, the nurse made sure to knock on the door before entering the room and also remembered to wash his hands. The nurse was also much more polite and used various open-ended questions, which was shown through the nurse asking about the different symptoms of insomnia, as well as asking for any things that the patient thought could have caused this illness. This helped the student nurse further assess the insomnia and provided a greater understanding of the patient's illness. The nurse also made sure to suggest a few non-pharmacological interventions to help with the patient's specific case rather than initially going to a drug for the illness.
The student nurse remained attentive towards the patient at all times during the interaction and took concern for the patient's needs and health. This helped the patient to feel cared for, having a greater understanding of the ailment, and helped to develop the patient's trust and respect for the nurse. This is how all nurses should strive to work in their careers, to act with professionalism, take pride in their work, and ultimately provide the best evidence-based nursing care for the patient.
This helped the student nurse. Stop.
He is predisposed.